Yes, hello, welcome once again. Sorry for this interruption. There was a network issue, but we were proceeding with our live for today. We are answering your questions about fertility and reproductive health. We answer your questions about fertility and reproductive health. We create awareness about fertility on this channel every day at exactly 5 p.m. That's around 17 hours every day. We do have live sessions on this channel where we do answer your questions on fertility, how you can get pregnant faster. Now, we were answering a question by one of our friends, Shanice, and I hope you're okay. Shanice, I have mentioned your name. I hope you're okay with it. And you were talking about polycystic ovarian syndrome, and then you've tried to get pregnant for 3 years, and this has not been very easy. What was happening? You also said that you did an HSG scan, and the HSG scan discovered what we call proximal blockage. And we had talked about this, and specifically I was asking what happened next. Did the doctors review you? Did you have another HSG scan done to confirm whether there was more blockage? Was the blockage worked on? Did the doctors unblock your tubes? Because at the end of it all, for a woman to get pregnant very fast, very easily, her fallopian tubes should be open. They should not be blocked. If the fallopian tubes are blocked, then tubal unblocking has to be done in hospital. So you asked a question, and the live stream ended due to network issues, but I thank God that we are back. I wanted to find out, did you have the unblocking done? And then you talked about PCOS, that is polycystic ovarian syndrome. Did you do some hormonal tests to see, some fertility tests, sorry, to really look at how your hormones are? Did you do the testosterone level test to assess and see how much testosterone is in your bloodstream? And then also, did you repeat the pelvic ultrasound scan? Although at this point, a pelvic ultrasound scan is not really very necessary. It was useful in the beginning when it helped us to confirm that you have polycystic ovarian syndrome. Since this is a long-term condition, we are more interested in the tubes, because the tubes play a very important function of transporting the fertilized egg, also known as a blastocyst, onto the inside of your womb, onto the inside of your uterus, known as the endometrium. So let me, just a few minutes, let me check if at all you're back online. That is Shanice Robinson from Jamaica. You are most welcome to our live stream. You asked a question that you have polycystic ovarian syndrome, and you were asking really what can be done. You've tried to get pregnant, but things have really been difficult. So let me know about what I've just talked about. Did you have tubal unblocking? And then also, did you do the repeat HSG to confirm that now your tubes are okay? Yes, because there are other procedures, there are other methods which can be advised, which can be given, or which your doctors can give you. For example, the IU, sorry. Yeah, for example, the IUI, that is the intrauterine insemination, where where your dominant or your mature egg can be taken, and then also joining can be done with the male sperm outside the lab, in the lab, and then this can be inserted back into your womb where growth will take place. So let me know if you really worked on all these, Shanice Robinson. The next question was asked by Nakawiye Christine. Nakawiye Christine, I can see you, you're back. And thanks really for sticking around. I thought you had you had signed out. So we are proceeding. Nakawiye Christine, your question was that you have you were asking for a friend. I remember you were asking for a friend, and the friend has tried to get pregnant, but to no avail. I mean, things have not worked out for your friend. And you also said that you did an ultrasound scan, known as a pelvic ultrasound scan, and the pelvic ultrasound scan was normal. And then you also said that period last week, okay, now in periods last week. Okay, I'm sorry. Nakabuya Christine, you were asking the question for your friend, and you said that your friend was in her periods last week. Okay, she's in her periods right now. She did an ultrasound scan and it was normal, but right now she's in her periods and she would like to know how she can get pregnant faster. Now, this brings us to a question, or this brings us to a topic known as the ovulation calendar. The ovulation calendar, the ovulation days, the days of ovulation, because for all women who are trying to get pregnant, it is very, very important to know your ovulation days. The days of ovulation or your ovulation days are those days when you are most likely going to get pregnant. They are those days when you have increased chances of getting pregnant. Because we know that the menstrual cycle has two phases. It has the follicular phase and then it has the luteal phase. We've talked about this. The most important thing we need to know is that if your friend is in her periods right now and she would like to know when she's going to get pregnant, let's assume she started her periods yesterday and then she saw her periods today and then she's finishing tomorrow. Tomorrow is it's going to be a Sunday. So if she saw her periods beginning with yesterday, which was Friday, today is Saturday, and then tomorrow is going to be Sunday. So we are in the month of September 2021. Yes, in the month of September. So if she finishes her periods tomorrow, we are more interested in the first day. We are interested in that first day when she first saw her periods. Tugambye nti omukyala waba yalaba periods ze yazirabye nga yatandise jjo and then nerero naziraba then agenda kumaliriza enkya ayagala kumanya naku ki zasobola okubanga agenda kufuniramu olubuto. Tuli more interested mu lunaku lwasoose okulaba periods ze. Olunaku olusooka lwe tuyita day 1. The first day you see your periods, that's what we call day 1. That's when you are actually starting your periods. We call it day 1. Now we are going to calculate the ovulation days. You count from yesterday when you saw your periods, and then you count yesterday it was day 1, today is day 2, tomorrow day 3. You count like that until you reach on the 14th day. Now the 14th day is the day of ovulation. This is for women with a regular cycle. Regular cycle means it's at least 28 days. When you see your periods, the next day or the next month you're going to see your periods. In between, there should be at least a difference of 28 days. Now, having got your ovulation day, we've said that the ovulation day is the 14th day of the menstrual cycle. That's when the egg is going to be released. Having got your ovulation day, which is on the 14th day, now what you will need to do is count 3 days backwards, and then you'll say this is the 14th day, assuming yesterday is the day 1, day 2, day 3. So basically on the 14th day, you count 3 days back. Those 3 days plus the 14th day, that's when you are ovulating. That's when you are most likely to be ovulating, although ovulation takes place on the 14th day itself. But we include these 3 days before you see your ovulation or before you ovulate, mainly because when ovulation happens, there's going to be a rise of a hormone known as luteinizing hormone. Doctors call it LH. So when this hormone rises, when this LH hormone increases in your bloodstream, then there's going to be release of that egg. The dominant follicle, the mature follicle, is going to burst, and then it's going to release a mature egg known as a Graafian follicle. When that egg has been released, it survives for only 12 to 24 hours. After this, it disintegrates, it disappears, it is no longer useful. So when you are to get your ovulation days, when you are to assess or when you are to confirm that this is when you are ovulating, of course you'll see the signs. There's going to be a rise in temperature, there's going to be an increase in the discharge coming out from your private parts, and then also you will also have increased libido or increased feelings of having being with your partner. So what's going to happen is that when this egg has been released, we've said that it survives for only 12 to 24 hours. The male sperm survives for up to 5 days. So we advise that you begin being with your partner at least 3 days to your ovulation day. Here, if you be with your partner, if you tell our friend you asked for your friend, if you advise her, she's in her periods right now, just tell her to count 14 days. From the first day she saw her periods, and then on the 14th day, that's when she's going to be ovulating. So I can see Nakabuye, you're back. Thanks a lot for joining us. Nakabuye, Christine, I'm really so happy to have you back, and I hope I've answered your question. You said that your friend did an ultrasound scan, and then the ultrasound scan was normal, and then she's in her periods right now. She would like to know how she can get pregnant faster. I've said that when she is in her periods right now, let her get the first day she saw her periods, and then let her count 14 days. On the 14th day, that is what we call the ovulation day. Now let her count 3 days back. Now those 3 days plus the 14th day, assuming that all factors are really constant and everything is normal, assuming that she's ovulating very well, assuming that she has normal open fallopian tubes, assuming that her uterus is free from disease, she will get pregnant by the grace of God. So I hope I've answered your question, Christine Nakabuye, and really so happy to have you on our live stream. So, and I can see you have another question. Let's check and see. Which tablets can I take and get twins faster without disappointment, and how long can it take to work and or plus blood group? Okay then, so Christine, thank you for asking the next question, and you are saying that which tablets can you take to get twins faster without disappointment. Now, when we are talking about the subject of twins, it's a controversial subject whereby there's lots of there are lots of videos here on YouTube talking about how to get twins faster and all that. But the key information we need to take from today's video is that during fertilization, a man, a male, we shall not go to man and woman. When a man and woman be together when they have sex, and then assuming that all factors are constant, assuming that the lady was in her ovulation days, and then the man has sperms of good quality and good quantity, the motility, the ability of the sperms to swim is very good. They swim the whole distance, and then fertilization has taken place. A male sperm carries chromosomes, and then a female egg also carries chromosomes. Chromosomes, we shall call them, they are kind of like shells which carry something inside which is known as the genetic material. The genetic material is what determines your eye color, your hair color, your skin color, and all that. So inside the man is chromosomes, and inside the woman is chromosomes. There's what we call the genes, the genetics, the hereditary material. Now, a male sperm carries what we call the X and Y chromosomes. And then a female egg, that is the egg of the woman, carries what we call, it carries the X and Y chromosomes. Let's take note of this very seriously, because many questions have been asked about this subject. When a woman who is having X and X chromosomes meets with a man who is having X and Y chromosomes, and then the man contributes the X chromosome, then we are going to end up with a girl. The girl is going to have the X and X chromosomes. And then when the man at this time contributes the Y chromosome, then we are going to have what we call the X and Y chromosomes fusing together, because a man contributes actually 23 chromosomes, and then a woman also contributes 23 chromosomes. 23 plus 23, we get 46. The fertilized egg, the growing embryo, has 46 chromosomes. A half from the mother, a half from the father. Now, these things happen without even your knowledge, without you even knowing that maybe there's the X fusing with the X chromosome, or there's a Y fusing with the Y chromosome. I mean, there's a Y fusing with the X chromosome. These things happen naturally. What am I trying to say here? The chances of a woman having having twins, whether identical twins or non-identical twins, all this happens at fertilization. There's no single drug that has been proven to really say that when you take it, you are going to get twins. No, I've not heard of one as yet. Maybe when it has just been discovered, but I've not heard of any drug that has been released that actually is for twins. So I would really say that for a man and a woman to have twins, normally, I as a Christian, I say that you pray about it. But still, there are procedures. You pray about it so that God can grant you your prayers. But there are procedures, due to science, there are procedures that have been developed. For example, the IVF, that is the in vitro fertilization, whereby the whole fusion, the whole joining of the male sperm and then the female egg takes place in the laboratory, and then they will be able to do what we call the pre-implantation gamete determination, whereby they will select the sex in the lab. Selection of the sex is done in the lab so that they actually get an embryo which is already determined that this is a male or this is a female. But these are very expensive procedures, and I would really say the best is you pray about it, you go on your knees, you pray about it, and when you pray, when you believe in your heart, God can grant you your heart's desires. So we have talked about this. I've answered your question about twins. You also, okay, without disappointment. Okay, then your question was, how can you get twins without disappointment? And I hope you've got the answer to this question. Everything happens without you knowing. Even without your husband knowing what is happening, everything happens during fertilization. Next thing is this. When a couple has a history of twins in the family, if your husband has a history of twins in their family, or you yourself you have a history of twins in your family, then there are high chances, according to studies, there are high chances of you having twins. So if you have that history of twins in the family, either on your side or on the side of your partner, your husband, then there are high chances that you could actually end up having a pregnancy of twins, bouncing twins. So I hope I've answered your question. Next question. Okay, Christine, you're saying you're really a teacher. Thanks so much. Doctor, I have understood it. Okay then, thanks a lot, Christine, for understanding our explanation. And I'm really so happy that you've understood it. Now, if you still have any other questions, please feel free to ask me your questions. I'm live. I'm right here on YouTube and on our channel, Gerald Massa, the Health Educator. I will be able to answer your questions. And please remember to subscribe so that you do not miss videos we release every day. Every day at exactly 5 p.m. in the evening, that is 17 hours. We are always live. We talk about fertility. We do answer all your questions. So we shall move on to our next question. Okay, we've not. Okay, Shanice Robinson. Yes, Shanice Robinson. Really so happy to see you again. You are most welcome. Thanks for sticking around and for joining us. I answered your questions when I was beginning this live session, and I hope you actually have got the answer. And if you still have any other questions, please, you can still ask. I'm really very happy to have you back, Shanice Robinson. And I can see, Shanice Robinson, you are saying that I sent a copy of the HSG result to your WhatsApp. Okay then, thanks a lot, Shanice. As soon as the live session is over, I'm going to go through, and then I'm going to go through your HSG results, and then I'll be able to discuss more and then see what's happening. But since I've not got any other question, okay, how do clomiphene tablets work? Okay, Shanice Robinson, as soon as the live session is over, I'll be able to go on my WhatsApp and then go through your HSG scan results. Then I'll advise accordingly. Thanks a lot, my friend, and let's proceed. Christine is having a question for us here, and she's saying, how do clomiphene tablets work to a woman who wanna get pregnant? Now, clomiphene tablets, clomid. Now, women know clomid. When you talk about clomid, women understand clomid. They understand clomid. They take clomid and all that. But I would really advise that, seriously, if you are to take clomid, if you are to take Clomid, please do not self-medicate. From the bottom of my heart, I'm requesting, please do not self-medicate yourself, either on Clomid or letrozole or any fertility drugs. Please do not self-medicate. The main reason is that these drugs have side effects. Just even as you see Panadol, paracetamol, if you overtake paracetamol or Panadol, it has effects on your liver. There are high chances that it can cause liver issues, and you may damage your liver, and when the liver is damaged, you know how much it is. A liver transplant is really very expensive. So please do not self-medicate. I'm not scaring you, I'm telling you the facts. So you are saying that how can a woman take Clomid? How do Clomid tablets work? Okay then, how do Clomid tablets work? Clomid specifically is a trade name, but the real generic name, the real name of Clomid is that it's called clomiphene citrate. Clomiphene citrate tablets. These are available in preparations or in milligrams of 50 mg, 50 milligrams. A woman is supposed to take Clomid on day 1, day 2, day 3, day 4. Basically, you take Clomid 1 tablet per day for 5 days. And then afterwards, you actually have to follow your doctor's instructions. And Clomid does not work alone. There are other procedures which need to be done for you. So before you take Clomid, it's always advisable that you first see your doctor, who will advise you on what to do. But specifically, in a nutshell, Clomid helps to stimulate ovulation. Remember, we said that ovulation is the release of the mature egg. So Clomid helps to facilitate this whole process of enabling your egg, which is known as the dominant follicle, to grow with some boosting from Clomid. And then when it grows and it is ripe, on the 14th day, it bursts, it is released, and then it fuses or it joins with the male sperm, and then fertilization takes place. So basically, Clomid just kind of like gives that gear, that booster gear, and then fertilization will take place very easily when the egg is stimulated. And then, of course, one thing you should take from this point or from this session is that when you overdose yourself on Clomid, you take Clomid this cycle, next cycle you take Clomid, next cycle you take Clomid. When you overtake Clomid, there are high chances that you can end up with what we call ovarian hyperstimulation disorder. Ovarian hyperstimulation. Your ovaries will be overstimulated, and when they are overstimulated, you can end up with a very big mass or a big swelling, which is known as a cystic mass, and it can actually rupture, and the results may not be good. The results may be life-threatening. So instead of putting your life at risk, taking Clomid every day without seeing a doctor, I advise, my friend, see a doctor before you take Clomid. The doctor will do some checkups on you. The doctor will do what we call a pelvic ultrasound scan, and then also your doctor will do what we call a fertility hormonal screen test. When the pelvic ultrasound scan shows that you have cysts, you don't need to take Clomid, because the Clomid is going to make the cyst to become so big. It's going to boost the cyst instead of boosting your ovaries. So how do Clomid tablets work to a woman who want to get pregnant? I hope I've answered this question. You actually take Clomid specifically when you're trying to get pregnant, but it actually just stimulates ovulation. And then remember, if you see your periods today, you see your periods tomorrow, and then you finish your periods the next day, you simply count 3 days, and then you begin on the 3rd day after seeing your periods. When the blood has stopped, you count 3 days when you're dry, and then you take 1 tablet of Clomid. Then you are on that day, that is on the 3rd day. The next day you take Clomid 1 tablet per day for 5 days, and then afterwards you be with your partner. On those days, we always talk about the days of ovulation, that is the 14th day, plus the 3 days next to ovulation. And then you put in prayers, everything can work out. It has worked out for many women, it can work out for you too. So we have our friend here, Shanice Robinson. Yes, Shanice Robinson, we have another question. Do you think IUI would be a good option to get pregnant? Intrauterine insemination would be a good option to get pregnant? To me, I would really say that if you have tried getting pregnant for at least a number of years, you have gone through the first steps. You've done all the scans, you've done the HSG scans, you've taken the chlomid, you've taken the letrozole, you've followed all the advice, and really things are not working out. If you can afford it, IUI is an excellent option for you. You can actually get pregnant through IUI, intrauterine insemination. So it is really, really very possible. As long as you can afford it, it's a good option, more so for women with issues in the tubes. If your tubes have issues, if your tubes have blockage, if you have blockage and it has been confirmed, the other way is you bypass the blockage. That is, you go through IUI or IVF. So IUI is an excellent option for women with tubal blockage, because at the end of it all, when a woman with blockage tries to get pregnant, there are high chances that the fertilized egg, which is known as a blastocyst, instead of traveling the whole way up to the uterus, it can actually stop in the fallopian tubes, and then it can grow in the fallopian tube. So that is, there are high chances of the baby growing in your fallopian tubes, which becomes an emergency. We call it an ectopic pregnancy. So IUI is an excellent option for women with proven blocked fallopian tubes. Another question? Okay. Christine, I can see you. You're saying that I was going to self-medicate myself to get twins. Oh, I'm really so sorry to to tell you this, but please do not self-medicate. Do not self-medicate. I believe you can get stories from your friends. They can tell you they've done this, and they've got twins. But please, just take it from the expert. Twins normally, or twins happen when fertilization takes place. That is, you have no control on this. You do not have control on twins when you actually be with your partner. What happens is that everything happens during fertilization. So, next question. Okay, I believe the questions are over, and remember, tomorrow we are going to be live again on this channel, Gerard Massa, the health educator, at exactly 5 p.m. That is 17 hours every day. We are live on this channel. We talk about fertility. We do answer some of your questions, or we do answer all of your questions. If you have tried to get pregnant, you have done some tests, and you would really like to know what's happening, we are always live on this channel. We do answer your questions. So remember to subscribe so that you do not miss new videos we release every day. And we've decided to do more live shows so that I can have a more one-on-one session with you. In case you have any questions, you can always ask. So before we sign out, let's check and see. Let's check and see before we sign out. I'm trying to check something here. Okay then, so I hope, Shanice, you're still on, and I thought that I could go through your report before the session ends. Okay then, so Shanice, I hope you're still on, and according to the conclusion here, we are looking at the left fallopian tube occlusion, and specifically the report says that the left fallopian tube is occluded, or it's blocked. What is happening is that having got this confirmation that it was the left fallopian tube that was occluded, and did you get management for this? Did you get treatment for this? Did the doctors unblock the tube? Let's talk more on WhatsApp. I believe I've got your information. After this session, we are going to talk more, but please, when you send me an answer, let me know, did the doctors do the unblocking, and was unblocking done? And then afterwards, we are going to talk more on WhatsApp. So remember, you can also send your questions, and we shall be able to answer your questions. We shall be able to talk more on this channel. Just go in the comment section and then ask your questions about fertility, about how you can get pregnant faster. You can also join me on my WhatsApp, and we shall talk more. Nsanyuse nnyo mikwano gyange okubanga mutujoyininze. Nakabuye Christine, nsanyuse nnyo ne mukwano gwaffe Shanice Robinson abadde ali kulaba video yaffe, nga abadde ali kulaba session yaffe ya live nga aviridde Jamaica, era tubadde naye alina ebibuuzo by'abadde abuuza, tubizzeemu byonna, and era abadde alina byabuuza ku kirwadde kye bayita PCOS era tubizeemu. Remember nawe oba olina ekibuuzo kyonna ekikwatagana ku ebyekikyala ekikwatagana ku osobola otya okufuna olubuto amangu, ogezaako okufuna olubuto biganye, osobola okubuuza mu comment section, osobola okugenda ne ku WhatsApp yange n'ombuuza. Gerard Massa, the health educator, is the name of the channel. I welcome you on our channel. Subscribe so that you do not miss new videos. May God bless and protect us all, and until tomorrow at 5 p.m, see you and stay safe.